Good afternoon. Good afternoon. We'd like to go ahead and get started. We'd like to go ahead and get started with our meeting here today. This is the meeting of the Assembly Health Committee. Some announcements before we begin. We'll be beginning as a subcommittee as we do not have a quorum. When we do have a quorum, we'll take roll and we'll go from there. We have a committee of 15. There's 3 of us, so we got a little ways to go. So we will hear 2 witnesses per side with a time limit of 3 minutes each. Additional witnesses will be asked to state only your name and your organization for the record and your position on the measure. There are 2 bills that are proposed for consent today. Any member of the committee can remove a bill from consent. The items are item number 2, SB 154 by Dr. Pan, item number 6, SB 784, which is a health committee bill. So with that, the first, and we take this in file order. So the first item before us is Senate Bill 24 by Senator Leyva. Please come on up.
Good afternoon, Mr. Chair. Good afternoon, members. I would first like to thank the chair and committee staff for their work on this bill and let you know that I will be happily accepting the committee amendment suggested on page 7 of the analysis. In 1973, this U.S. Supreme Court ruled that the Due Process Clause of the 14th Amendment to the Constitution provides a fundamental right to privacy that protects a woman's right to choose whether or not to have an abortion. As we all know, this landmark case was Roe versus Wade. Now, almost a half a century later, people, groups, and institutions have done everything they can think of to restrict access and to shame any woman who chooses to have an abortion. Though our former governor may have believed that it was not unreasonable for a college student to travel off campus to access medication abortion, I respectfully and profoundly disagree. Members, just 3 years ago, a group of committed UC Berkeley students started a grassroots effort to bring medication abortion to their on-campus student health center. After speaking to their administration and raising significant funds to that end, they were rejected by the school administration, at which point I was asked to lead the effort here at the Capitol. SB 24 is a continuation of that effort. The College Student Right to Access Act would require all on-campus student health centers at public universities to provide medication for early pregnancy termination for their students by July 1 of 2023. Research from UC San Francisco estimates that every month, 519 students at the 34 UC and CSU campuses seek medication abortions at off-site healthcare facilities. If we truly value access to abortion in California and the importance of supporting student success, then it's critical that these hundreds of students every month are able to access these services on campus. Medication abortion is a 2-step process where a patient takes 2 sets of pills over the course of 2 days during the first 10 weeks of pregnancy. According to a UC San Francisco study, medication abortion is very safe, with major complications occurring in only 0.3% of cases, making it safer than Tylenol or Viagra. Though many California public universities already offer reproductive health care services, such as pregnancy options counseling and contraceptives, none currently offer access to medication abortion on campus. Medication abortion is clinically simpler than much of the care already offered at student health centers, such as diabetes management, mental health care, and diagnosis or treatment of sexually transmitted diseases. Access is severely limited for students since only 15% of the closest off-campus abortion providers are open on weekends, meaning that students may have to miss class, exams, and work to access abortion. which the Supreme Court determined almost half a century ago is a protected constitutional right. Being able to access medication abortion on college campuses is critical, since women must receive this care within the first 10 weeks of pregnancy. And most women don't even know they're pregnant until they're 5 or 6 weeks along. Members, the right to choose isn't just a slogan, but rather a commitment to improving true access to abortion for Californians across our state, including college students at our public universities. Here with me today is Dr. Daniel Grossman, a professor in the Department of Obstetrics and Gynecology and Reproductive Sciences at the University of California, San Francisco, and Director of Advancing New Standards in Reproductive Health Research Program, and Grace Pang, a student at San Jose State University. Dr. Grossman.
Thank you very much. Good afternoon, and thank you for the opportunity to speak today before the committee. As Senator mentioned, I'm a physician and professor in the Department of Obstetrics and Gynecology at UCSF, and our research program has published 2 studies in peer-reviewed journals related to the College Student Right to Access Act. The first looked at how often students seek abortion care and whether they face significant barriers. Students across the UC and CSU campuses obtain approximately 1,000 abortions each month, and we estimate that as many as 500 medication abortions would be provided monthly on campus if student health centers offered that service. Across all public university campuses, considering that this service requires 2 visits, the median time by public transport to the closest provider is 2 hours round trip for medication abortion, and it's up to 4 hours for some campuses. According to the California Code of Regulations, traveling more than 30 minutes for health care renders that care inaccessible. For the second study, we looked at the capacity of the student health centers to provide medication abortion on campus and what they would need. All the UC and CSU student health centers already provide reproductive health services. They employ or contract with at least one physician or an advanced practice clinician, and they have the needed physical space to provide this service. In order to be able to offer medication abortion, they would all need training, they would need an ultrasound if that's needed, and 24-hour telephone support to triage patients if they don't already have that set up. Given these findings, I believe that abortion care on campus is necessary to improve access and decrease barriers for students, and I also believe that with the funding that's been committed, it would be very feasible to offer medication abortion at the student health center. There's no reason to exclude medication abortion from the care that is already provided at the student health centers. As Senator Levin noted, medication abortion is safe and simple to provide. Over 3.7 million women in the United States have had a medication abortion, and serious complications are very rare. In fact, the health risks are significantly higher for women who choose to continue a pregnancy to term than they are for women who choose medication abortion. Just 2 months ago, the FDA approved a new generic form of mifepristone, which is the main drug used in medication abortion, further confirming the agency's view that this is a very safe and effective treatment. Thousands of UC and CSU students get pregnant each year while attending school, and with the training that this legislation will make possible, I believe that not only will abortion access be expanded for students, but the student health centers will improve their overall reproductive health services, including miscarriage management, timely referrals for pregnancy-related complications, as well as provision of a wider range of contraceptive methods. Thank you very much, and I'm happy to answer any questions you may have.
Great, thank you. Next witness, please.
Hello, my name is Grace Pang, and I'm a sophomore at San Jose State University, originally from Oakland. Thank you for having me today. This year, I began organizing on my campus to expand access to reproductive health care, including abortion care. As a low-income first-generation student of color, it is important to me to fight for reproductive health care so that other students down the line don't have to. Right now, with other states passing laws that ban abortion, California has an opportunity with Senate Bill 24 to be a leader in expanding access to care. Even in a state without major abortion restrictions, we know as students, especially students of color, students who are already parents, students struggling to make ends meet, and other marginalized communities still face obstacles to accessing abortion. My campus has the highest number of homeless students in the CSU system. An unacceptable 13% of us have unstable housing, sleeping in cars, at friends' houses, and in the library. 42% of CSU students don't know where their next meal is coming from. Students I know don't all have cars or are anxious about going to a provider that they don't know. The extra cost for transportation to an off-campus abortion provider adds to the stress that students are already facing trying to meet their basic needs. This is a student health issue, an academic retention issue, and ultimately an equity issue. I serve on the California State Student Association, and I'm proud that this year, for the first time, the association endorsed SB 24. Together with the UC Student Association, which also endorsed the bill, we represent more than 700,000 students across California that support abortion care on campus. I urge you to trust us students and vote yes on SB 24 today. Thank you.
Thank you very much. Are there others in support? This will be.
Mr. Chair and members, Vanessa Hina on behalf of California Latinas for Reproductive Justice, proud co-sponsor of the bill, here in support.
Perfect, thank you.
Hi, my name is Sonia Goch Avila, alumni of UC Santa Cruz, and strong support.
Thank you.
Hi, I'm Carly Vendero, UC Berkeley alumni and strong support.
Thank you.
Hi, my name is Vania Del Villar, and I'm a UCR student, and I strongly support.
Thank you.
Hi, my name is Sandy Hernandez. I'm from UCR, and I strongly urge you to support this bill.
Thank you.
Hi, Stephanie Zayu with the Commission on the Status of Women and Girls in support.
Thank you.
Molly Robeson, Planned Parenthood Affiliates of California, strong support.
Thank you.
Angel Huerta with Planned Parenthood Generation Action at UC Riverside and strong support.
Thank you.
Hi, my name is Amelia Martinez from Student UCR, and I'm strongly support this bill.
Thank you.
Hi, I'm Katia Moya from UCR, and I strongly support this bill.
Thank you.
Hi, my name is Vanessa Blaylock. I'm a student at Pitzer College, and I strongly support.
Thank you.
Hi, my name is Sophia Manju, a student from the University of California, Riverside, and Planned Parenthood Generation Action, and strong support.
Thank you.
Hi, I'm Deanna Duran, a CSU Northridge Public Health alumni, and I strongly support this bill.
Thank you.
Hi, I'm Marissa Martinez, an undergraduate from UC Merced, and I strongly support this bill.
Great, thank you.
Rebecca Gonzalez, National Association of Social Workers, California Chapter, in support.
Thank you.
Austin Chen with CSU Fullerton, and I strongly support this bill.
Thank you.
Kathleen Singh, graduate of UC Berkeley, and I strongly support this bill.
Thank you.
Gabriel Pineda, University of California, Riverside, and I strongly support.
Thank you.
Judith Ohan, UCR alum, and strong support.
Thank you.
Alia Murphy, UCLA undergraduate representative for the UC Student Health Insurance Plan Executive Oversight Board, and I strongly support.
Thank you.
Frankie Hernandez, Public Health and Health Equity student at Mills College, and strong support.
Thank you.
Ariana Ayala, Crafton Hills College student, and strong support.
Thank you.
Hi, Jessie Rosales, UCR alumni, here to represent the National Network of Abortion Funds and Advocates for Youth and strong support of SB 24.
Thank you.
I'm Nicole Maida from San Diego State, president of Macro Social Work Student Org. I strongly support.
Thank you.
I'm Elena De Necochea, student at Sacramento State, and I strongly support. Thank you.
Thank you.
Amanda Dworkin, student at UCLA Law and UC Davis alum, and strong support.
Thank you.
Courtney Carew, student at UC Davis and member of the campus chapter of California Women's List, and I strongly support.
Thank you.
Raya Kasravi, student, and I strongly support.
Thank you.
Kia Duggins, student, and strong support.
Thank you.
Megan Jones, student, strong support.
Thank you.
Lauren Lowe, president of Students for Reproductive Freedom at UC Davis and also representing the ASUCD External Affairs Commission, in strong support.
Thank you.
Garrett Mueller, member of our student government at California Lutheran University, and strong support.
Thank you.
Alondra Esquivel Garcia, Vice President of External Affairs for Associated Students at San Francisco State University and a high school facilitator for Ignite National, and I strongly support.
Revere Woods, student at University of California, Riverside with Planned Parenthood Generation Action, and I strongly support.
Thank you.
Good afternoon, I'm Mona Shushtari. I am a sophomore at San Jose State University and founder and president of Ignite National, and I strongly support this bill.
Thank you.
I'm Kevin Wren with Shout Your Abortion, and I strongly support this bill.
Thank you.
Dr. Matulich, practicing OBGYN in Sacramento and abortion provider, and I strongly support this bill.
Caitlin Esparza, medical student at UC Davis School of Medicine, and I strongly support this bill.
Thank you.
Kevin Mortazavi, alumni of UC Riverside and current medical student at UC Davis, co-president of Medical Students for Choice, and we strongly support this bill.
Thank you.
Kyle Kim, medical student at UC Davis School of Medicine and former reproductive options counselor, and I strongly support this bill.
Thank you.
Mr. Chair and members, Sylvia Solisha on behalf of the 24,000 faculty, staff, librarians, coaches, and counselors of the California Faculty Association in strong support.
Thank you.
Day Nava with the Women's Foundation of California, a co-sponsor of this bill in strong support.
Thank you.
Maya Ingram, ACLU of California, co-sponsor in strong support and proud UCLA Law alumni.
Alice Kessler on behalf of Equality California and UC Davis alumni in support.
Libby Benedict, proud UCLA Bruin from a year I can't even say out loud, but I strongly endorse or hope for your I support on 24. Thank you.
Thank you. We're going to hold for 1 second. We have a quorum, so I want to take roll, and then we'll be able to take action on this bill once we do that. So, Madam Secretary, please call the roll.
Wood?
Here.
Mays? Here. Aguiar Curry? Bigelow? Bonta? Burke? Carrillo? Flora? Limon? McCarty? Nazarian? Ramos? Rodriguez? Santiago? Waldron?
Okay, we have a quorum, so please continue.
Thank you. Debbie Bamberger, nurse practitioner, abortion provider, and current UCSF doctoral student in strong support of the bill.
Taylor Ward, UC Davis alumni and current graduate student in public health and urban planning at UCLA, and I strongly support this bill.
Thank you.
Nana Sarkadiadu, University of Southern California alumni and public health and social work student at UCLA, and I strongly support this bill.
Thank you.
Jacqueline Chavera, UCI alumni and current MPH student at UCLA, and I strongly support this bill.
Thank you.
Sophia Stremmel, student at UC Berkeley with Students United for Reproductive Justice, a co-sponsor of the bill in strong support.
Thank you.
Linda Tenerowitz with the California Pan-Ethnic Health Network in strong support.
Thank you.
Rachel Wallace, public policy graduate student at UC Berkeley in strong support.
Thank you.
Orla Reve, Jewish graduate from UC Berkeley, and I strongly support this.
Thank you.
Noelle Jones, co-sponsor with Students United for Reproductive Justice, working on this for 4 years. We're in strong support.
Thank you.
McKenna Fetzer, a junior at UC Berkeley and in strong support of SB 24.
Thank you.
Jen Flory on behalf of Western Center on Law and Poverty in support.
Thank you.
Shannon Hovis, NARAL Pro Choice California. We are a co-sponsor on the bill. On behalf of our 230,000 members statewide, we are in strong support.
Thank you.
Rachel Coe, alumni of California Community Colleges and UC Berkeley class of 2012 with Access Women's Health Justice, co-sponsor, strong support.
Thank you.
I'm Eleanor Bimler-Schwartz, professor of medicine at UC Davis, board-certified internist, and strong support.
Thank you.
Magali Zagal with American Association of University Women and a proud UC Davis Law alumni.
Thank you.
Ryan Spencer on behalf of the California Academy of Family Physicians and the American College of OBGYNs District 9 in support.
Thank you.
Ryan Hicks, citizen in support.
Thank you.
Angela Gilliard with the University of California. We are not in support or in opposition. We have a no position on the bill. May we approach to read a brief statement?
Typically, we take opposition or support. You just very briefly state your position. Just state your concerns briefly from there, please.
Okay. So the University of California mandates that all students have health care. The university operates a health plan for students called UC SHIP. Reproductive health care is considered an essential benefit for students, and the university fully supports reproductive rights for its students. We have not wavered in our resolve. However, UC does not have a position on SB 24 because there are outstanding issues we are working through with the author. The issues are primarily around implementation and costs. While most of the public conversation surrounding the bill is centered on women's rights to choose, this has never been an issue for the university. We have made it clear on repeated occasions that we support a woman's right to choose. The problems with access to this service are not proximity, rather the problems are that referrals have not been made seamlessly, and they should be. For these reasons, we understand the authors would like the service to be provided on campuses directly, which will help resolve some of the insurance connection type issues students have experienced. We have been working on solutions with the author's office, and we still need to solve a few problems related to funding beyond implementation in 2023. Bringing this service on campus without a funding source beyond 2023 could increase costs to students since student health centers are supported by student fees. We know we have a champion and a good working relationship with Senator Leiva's office and are hopeful that we can resolve these out funding issues. Thank you.
Okay, thank you.
Hi, Maggie White with the California State University. I'll be very brief. We are in a pending position on the bill, but want to thank the author and her staff for the ongoing dialogue. We continue to have concerns around implementation and ongoing costs. We look forward to addressing this collaboratively with the author and her staff. Thank you.
Thank you very much. So is there anyone in opposition to testify? Then we'll have others in opposition at that point. So testimony in opposition, please come forward. Thanks. So as before, 3 minutes each. Thank you.
Hi, my name is Marylee Shrider. I'm Executive Director of Right to Life of Kern County and Political Advocacy Chair for Californians for Life. I'm here merely to answer any questions you may have, but I would like to yield my 3 minutes to Dr. Braatz for 6 minutes.
Actually, it's 3 minutes each, so thank you.
Good afternoon, Mr. Chairman and committee members. I'm Dr. Stephen Braatz. I'm a board-certified OBGYN with 35 years of practice experience. I first came to California in 1992 as a Navy doctor, stationed at the Marine Corps base at Camp Pendleton, and I also served many years at the Naval Medical Center in San Diego as the chairman of the OBGYN department there. I've served with the Marine Corps 1st Medical Battalion in Somalia in the Iraq War. I retired from the Navy in 2008, moved to Susanville, wanted to work in an area where there was a lot of medical need, and really enjoyed practicing there for the last 11 years. My wife and I have 3 kids who've all graduated from California universities. I'm currently serving on the board of the American Association of Pro-Life Obstetricians and Gynecologists. With medical abortion on college campuses, what will be the risk for patients? With medical abortion, we find that complications are not so rare. Women who take mifepristone for abortion have much greater risk of hemorrhage and fatal infection and more failures requiring emergency surgery than women who have surgical abortion. The complication rate, including cases of hemorrhage, infection, or where surgery was performed, is in most studies 3 to 6%, and I've filed my references with the Master at Arms. They are on file. In one study, the rate of hemorrhage was 15%, and in another, 17% of patients required surgery. Complication rates could be even higher than we find in the literature because of difficulties with billing codes and large numbers of patients lost to follow-up in some studies. So roughly 1 out of every 20 women who have a medical abortion will have a complication such as bleeding, sometimes requiring a blood transfusion, and or need for surgery because of pregnancy tissue left inside the uterus. Between 2000 and the end of 2018, there were 4,195 adverse events reported to the FDA, including 24 deaths, 97 ectopic pregnancies, over 1,000 hospitalizations, excluding deaths, and 499 blood transfusions and 412 infections. I've had an opportunity to look at these adverse event reports. Do I have the whole 6 minutes?
They said only 3.
You have 3 minutes.
Okay. So the bottom line here is that some complications are going to occur. And the question is, are we ready to handle those complications?
Continuity of care is something we strive for and safeguard patients and maintain quality. With especially medical abortion, patients having complications sometimes find that the clinic is closed and show up in the emergency room. If the 24-hour hotline is telling patients to go to the emergency room, it's not good continuity of care. Ultrasound procedures need supervision. Training doctors, nurses to do that will be difficult and will require a large volume of patients for supervised ultrasound training. This bill won't meet its stated objectives. Misoprostone abortions will be inconvenient for patients, taking much longer to complete compared with surgical abortion. Medical abortion requires a visit to receive the drugs, hours or days of cramping and bleeding, a possible ER visit, and then follow up with the clinic again. According to data compiled by Californians for Life, abortion clinics are located an average of only 6 miles from universities in California. As a physician, I'm concerned for the quality of care or lack of care patients with complications will receive, and for the university system's ability to manage these complications. As a California taxpayer, veteran, and pro-life Californian, I oppose and ask you to defeat SB 24. Thank you so much for your attention.
Thank you. Others in opposition, just your name and position, please.
So my name is Joseph Dunca. I'm a God-fearing Christian, and based upon all the God-fearing Christians, I'm opposing this bill.
Okay, thank you.
My name is Shane Caldera. I'm a born-again Christian. On behalf of all the innocent children in the womb, I strongly oppose this bill in Jesus' name.
Thank you.
Judy Goad, Right to Life of Kern County, and I strongly oppose this bill.
Thank you.
Corinne Han, Aggies for Life from UC Davis, and I oppose this bill.
Thank you.
Anna Bach, I'm the Northern California Regional Coordinator for Students for Life of America, representing 90 student groups in California and 1,200 student groups nationally, and we strongly oppose SB 24.
Brian Brackney, proud 1980 graduate of UC Santa Barbara. I oppose this bill.
Thank you.
My name is Robert Bird from San Francisco. I'm a member of Pro-Life San Francisco, and I urge you to vote no on SB 24.
Thank you.
Maria Jose Fernandez Flores with the California Catholic Conference in opposition.
Thank you.
My name is Lori Braatz. I'm a registered nurse working in labor and delivery. I strongly oppose this bill.
Thank you.
My name is Deborah Thomas. I'm a graduate of California State University, Hayward, and I'm a member of St. Mary's Church in Vacaville, and I strongly, vehemently oppose the bill.
Thank you.
Wynette Sills, Director of Californians for Life, and on behalf of increasing number of Californians who recognize the humanity of the child in the womb and the trauma abortion causes women, I urge a no vote on this bill.
Thank you.
Carly Heil, St. Mary's, Respect Life, Vacaville, California, and I oppose this bill.
Thank you.
Mary Sari, mother and grandmother, former registered nurse in labor and delivery. I formally really oppose this bill.
Thank you.
Linda Mimnaugh, registered nurse, graduate of UC San Francisco. I ask you to vote no on this bill. Thank you.
Thank you.
Reverend Olga Herman, with the Life Teams International and the Prayer Council United States, we strongly oppose of this measure. Young people, these are your babies.
Thank you.
Greg Burt with the California Family Council in strong opposition. Thanks.
Thank you.
Jenny Shoup from Bakersfield with a niece at Cal Poly. I strongly oppose this bill.
Thank you.
My name is John Shute from Bakersfield, and I oppose this bill.
Thank you.
I'm Ralph Merletti, a 1970 graduate of California State University Northridge and a member of St. Rose Catholic Parish, South Sacramento. I strongly oppose this dangerous and unnecessary bill.
Thank you.
Alban Romberg, University of California alumnus, representing prenatal murder opponents, asking you to oppose prenatal murder, especially in our universities across the state.
Anyone else in opposition?
Assemblymember Wood.
I'm sorry.
I'm sorry. We were under the impression that if I yielded, he could have all 6. Can I have a minute?
You can have 1 minute.
I can have 1 minute. Very good. In committee hearings on the bill, witness testimony and legislators' inquiries focused on medication abortions, perceived impediments to pregnant students' access to such abortions, and related cost and liability concerns. However, at no time has anyone posed the most relevant question: is abortion medication by techniques the most effective method in reaching the stated goals of SB 24? Research by recognized experts in obstetrics and gynecology strongly indicates it is not. In his veto message of SB 320, Governor Jerry Brown dismissed the bill as unnecessary, but he was only half correct. Not only are abortions by medication techniques unnecessary on college campus, they are contraindicated. According to the American College of Obstetricians and Gynecologists, a pro-choice professional organization of more than 58,000 members, women who desire quick completion of the abortion process are not considered good candidates for medical abortions. I'd also like to add that the fact that anything speech, guns, abortions is a constitutional right does not preclude citizens from implementing some limited restrictions. Law-abiding permit-carrying gun owners cannot carry their guns everywhere they wish, including into this Capitol building, and as a matter of consistency, it is not the state's role to make sure concealed carry permit holders have access to all the firearms they desire. Then it is likewise not the state's role to mandate that college students are never inconvenienced in pursuit of unlimited access to abortions. Nor is it the state's role to mandate that public universities be obligated to provide access to abortions on their premises, and furthermore, to be open to using student fees to do so. Thank you.
Okay, thank you very much. Bring it back to the committee for questions or comments. Questions or comments from the committee? Ms. Carrillo.
Thank you, Mr. Chair. Hi, Senator. Thank you. Very good. Thank you. Thank you so much for having the courage to bring this bill back again into the legislature. I'm proud to be a principal co-author for SB 24 and have some prepared remarks that I'd like to share. In light of recent events in Alabama, Louisiana, Georgia, it is our duty as legislators to uphold and protect the guaranteed right to abortion access that is currently under attack, not only in the state of California, but across the country, and I would say around the world. SB 24 will help ensure that the right is protected for all Californians and that the right is upheld throughout all public institutions, including CSUs and UCs. Basic health services, even on the CSU and the UC campuses, include pregnancy counseling, contraceptives, and other reproductive services, but arbitrarily stop short of medication abortions. This lack of access causes unnecessary logistical and financial stress to disadvantaged students. And I would also like to add, this is not an issue that only impacts women. This is an issue that impacts both partners in that situation, both male and female. The lack of access clearly is an issue. Alternative medical facilities and treatments off campus are often not an option, given that 51% of students enrolled across CSUs and UCs are low income, and a portion of UC students and CSU students do not have access to reliable transportation. Allowing access to medication abortion on college campuses guarantees a safe outlet for students, particularly low income and students of color, who deserve access to these life-altering treatments at their universities where they are safe and in a sound place. Offering medication abortion at public universities will ensure the physical, mental, and financial well-being of our students is prioritized. Students must have their right to abortion access, and they must be given the necessary services required to focus on and pursue their academic success. I am proud to be a principal co-author for SB 24, and I will encourage everyone to understand the rights of women, the rights to reproductive justice, and ensure that the young men who are also equally as responsible are also at the table, and ensure that their partners are safe at the college campuses. So thank you again for having the courage to bring this up again.
Great, thank you. Other questions or comments? Ms. Waldron.
So I know the governor vetoed the bill before, and it was based on the fact that there's services within under 5 miles to 7 miles of 33 or so of the campuses already. So since services are widely available and nearby, he deemed the bill unnecessary, and I'm just wondering what would be, nothing's changed in that regard.
As I stated in my opening, I profoundly disagree with the governor, and it's not medicated abortion, or abortion, in fact, is not readily available within all 34 campuses. So the governor and I don't agree. He vetoed it, and we're back.
Okay, so I know the goal has always been to make abortion rare, but doing this will actually make it easier. So I'm just, you know, that's just a statement of mine. But I wanted to ask the doctor, the opponents, if I may. So, and I've, you know, done research because I had a bill a couple of years ago regarding the RU 486 as well. So, and, you know, you would know, I mean, if someone takes this medication, there's going to be bleeding. There's going to be pain. There's going to be possible issues. Like you said, there's sometimes severe conditions. Basically, the baby has to be expelled. And that could happen in the dorm bathroom with a girl alone. And I'm a mom, and you know, they're considered adults at 18, and you know, I have a son who's 18, and it's hard to imagine that they can really make adult decisions. But my heart goes out to these young women who will be alone in a dorm expelling a child. And I want to ask the doctor, I mean, what happens? What's the reality of taking this pill?
Thank you for the question. It is true that when a woman takes the pills involved in the medical abortion procedure, she is going to experience pretty severe cramping, very heavy bleeding. That's something I think that we all agree upon, that patients are informed about. Sometimes the bleeding is so severe that patients need to go to the emergency room, sometimes just for reassurance that they're not hemorrhaging to the point of needing medical assistance, but sometimes they are bleeding that heavily that they do need an urgent procedure to complete the abortion, to remove tissue from the womb, and sometimes even a blood transfusion. The fact is that if currently women in California universities are in living situations where transportation is difficult, where they don't have a lot of support, they would be the worst candidates for this kind of procedure, or they may end up by themselves bleeding heavily, in a lot of pain, maybe not able to get to a phone or get to the help they need. They would be the worst candidates for this kind of procedure, and it's going to require, as I said, more time for them to complete the abortion procedure than, say, if they had gone for a first trimester surgical abortion. Thank you for the question.
Just as a follow-up,
Assembly member, may I also respond? Whether or not this procedure is offered on campus, women will still, and students will still have medicated abortion. They will go off campus to get the medication, and they will come back, and they will still be in their dorm room. So this bill does nothing to change that.
well, it's making it much more available is the point I was making.
That is correct.
What kind of supervision is there medically on the campus where at least, you know, they go to a doctor, they have some way they can contact the doctor or the nurse?
And they would be able to contact the health center as well.
So even after hours,
yes,
they're available?
It would be similar to if they obtained the medication off campus and something happened at 1 a.m. in the morning, they would have to go to an emergency room, whether they obtain the medication on campus or off campus. So that doesn't change.
So in the physician world, and I'm not going to pretend to be a physician, how late in the pregnancy can they do RU
10 weeks.
486? So 10 weeks.
10 weeks.
So at 10 weeks, a preborn child has a beating heart, arms and legs, feet, hands. I'm just, you know, as a mom, it's just traumatic to think of a young girl alone when that happens. So, I mean, for me, I just think, and I'll just make my statement, SB 320 does nothing for pregnant students who want to keep their babies and need help to do so. the only assistance the university will give them is having an abortion. So
They already provide pregnancy counseling on campus. That would not change.
And do they refer them to crisis pregnancy centers or?
They may not. I don't know what each campus does specifically, but I do know that they offer pregnancy counseling.
So I will not be supporting the bill today.
Thank you, Assembly Member.
Anyone else? Questions or comments? Okay. Thank you for bringing the bill forward. Would you like to close, Senator Leyva?
Thank you, Mr. Chair. Members, thank you for your time, your attention, and your discussion. I would just like to make it very clear that this bill is not asking any woman to have an abortion. This bill is still making sure a woman has her right to choose and what she wants to do. It is no different than traveling off campus. Does it make it more accessible? Absolutely it does. That is the whole point of the bill. And sometimes we just have fundamental disagreements in life, and that's okay. While other states are taking a giant leap backward to the days of forced pregnancy and misogyny, SB 24 will continue to move California forward by reaffirming the constitutional right of college students to access abortion care without delay. All Californians, including college students, should have access to the full range of choices of reproductive health care services so that they can plan their futures and achieve their personal and professional goals. I respectfully ask for your aye vote.
Well, thank you very much, Senator Leyva. The bill does enjoy a do pass recommendation. Is there a motion? Second. We have a motion by Ms. Carrillo, a second by Mr. Rodriguez. The motion is do pass as amended to higher education. I'll ask Madam Secretary to please call the roll.
Wood?
Aye.
Wood, aye. Mays?
No.
Mays, no. Aguirre Curry? Aguirre Curry, aye. Bigelow? Bigelow, no. Bonta? Burke? Carrillo? Aye. Carrillo, aye. Flora? Limon? Aye. Limon, aye. McCarty? Nazarian? Ramos?
Not voting.
Ramos not voting. Rodriguez?
Aye.
Rodriguez, aye. Santiago? Waldron?
No.
Waldron, no.
So the vote is 5-3. We still have members missing. We'll leave the bill on call. Thank you very much.
Thank you, Mr. Chair. Thank you, members.
Another bill.
I do.
And an SJR.
Yes.
Okay. Well, thank you all to all the witnesses who came, and I'm a shout out to all the UCR Highlanders. Thank you for being here, and everybody else. Thank you.
301. Very good. Good afternoon again, Mr. Chair and members. For many years, California has made a concerted effort. Welcome. A concerted effort to expand and protect quality family planning services, but recent changes in federal policies jeopardize access to those critical services. Part of that commitment is Family Pact, which is a Medicaid program administered by the Department of Health Care Services, DHCS. Family Pact services include all FDA-approved contraceptive methods, emergency contraceptives, testing and treatment of sexually transmitted infections and urinary tract infections, along with screening for breast and cervical cancer. This important program serves 1.1 million low-income and uninsured individuals in California through 2,200 public and private providers. Currently, Family Pack is funded by a 90-10 federal match, meaning that for every $1 invested in family planning care, the state receives 90 cents from the federal government. Over the past 2 years, federal proposals have called for shifting all federal Medicaid funding to states to a block grant form. If such proposals were to be implemented, the current match for family planning services in California could be threatened. Without a plan in place, access to family planning services for low-income and uninsured Californians could be disrupted and significantly reduced. SB 301 provides the framework for that plan. In the event of reductions in federal funding, SB 301 would require DHCS to submit a plan to the legislature within 60 days of any federal action that would alter current funding and ensuring the sustainability of California's Family Pact program. Here with me in support is Sylvia Castillo from Essential Access Health.
Move the bill.
Second.
Please go ahead.
Good afternoon, Chairman and members. My name is Sylvia Castillo, and I'm here representing Essential Access Health. We champion and promote quality sexual and reproductive health care for all. The state legislature established the Family Pact program in 1996 as a Medicaid waiver demonstration project with the goal of providing cost-effective with the goal of providing cost effectiveness of making family planning care widely accessible. And the program has continuously proven its success. Program evaluations by UC San Francisco showed that every dollar spent on the program, the public sector saves $9.25 in public health and social service expenses. Over the past 3 decades, Family Pact and Title X have partnered to reduce unintended pregnancy rates in our state to historic lows. In that 30-year span, California reduced its teen pregnancy rate by 70%. The Trump-Pence administration has already attacked reproductive health care services. California must take steps to plan for all scenarios, including a potential funding loss for the Family Pact program, to protect access to vital health care services. California has already enacted several measures to hold the line and protect access in the face of hostile actions on the federal level. SB 301 would just simply call on DHCS to create a sustainability plan should federal funding changes occur, and I respectfully request your aye vote.
Thank you very much. Others in support? Thank you.
On behalf of the California Academy of Family Physicians and the American College of OB/GYNs, District 9, support.
Thank you.
Rebecca Gonzalez, National Association of Social Workers, California Chapter, in support.
Thank you.
Rachel Coe, Access Women's Health Justice, in strong support.
Thank you.
Kat DeBerg, Health Officers Association of California, in support.
Thank you.
Eleanor Bilmo-Schwartz, Professor of Medicine, in support, would point out that while rates of maternal mortality have been increasing around the country, California is the only state where we've seen rates of maternal death go down. The Family Pact program deserves a large due credit for allowing women with chronic medical conditions to access family planning services, whether or not they have the income to do so independently.
Thank you. Is there opposition to the bill? Seeing no one, we'll bring it back to the committee for questions or comments. Questions or comments from the committee? Seeing none, would you like to close, Senator Leyva?
Respectfully ask for an aye vote.
It does enjoy a do pass recommendation. It isn't easy for me to say, apparently. We have a motion by Ms. Aguiar-Curry, a second by Mr. Rodriguez. I'll ask Madam Secretary to please call the roll.
Wood?
Aye.
Wood, aye. Mays? Mays, aye. Aguiar-Curry? Aguiar-Curry, aye. Bigelow? Bigelow, aye. Bonta? Burke? Carrillo? Flora? Flora, aye. Limon? Limon, aye. McCarty? Nazarian? Ramos? Ramos, aye. Rodriguez? Rodriguez, aye. Santiago? Waldron?
You have 8 votes. That bill is out. We'll leave the roll open for others to add on. And finally, you have item number 7, SJR 4.
Thank you, Mr. Chair. Good afternoon again, members. Title X is a federally funded program dedicated to family planning services. These important services include contraceptive care, pregnancy testing, diagnosing and treating sexually transmitted infections, infertility services, and pregnancy options counseling. These funds can also be used for education and outreach that help link individuals with care. Earlier this year, the federal government released revised funding regulations for Title X. These regulations deny patients information about their health care options, disrupt the provider-patient relationship, and deter Californians from accessing care. By tying federal funding to these regulations, many healthcare organizations and qualified family planning providers in California will be forced to choose between a critical funding source and accepting regulations that will reduce access to quality, time-sensitive care for low-income residents. According to Essential Access Health, approximately 1 million Californians are served by Title X programs, accounting for 25% of Title X patients nationwide. With me in support is Sylvia Castillo from Essential Access Health.
Hello again, and thank you for the opportunity to speak. Essential Access Health, we administer the Title X program here in the state. Our network of clinics includes 363 clinic providers that serve 1 million patients each year. So the agencies that receive this funding include federally qualified health centers, urban Indian health centers, university affiliates, Planned Parenthood affiliates, and other women's health centers. Several city and county public health departments also receive Title X funding, including the public health departments in the counties of Tulare, San Bernardino, Los Angeles, San Luis Obispo, Butte, Nevada, San Francisco, and the city of Berkeley. all of these public health departments would be affected if these regulations would take effect. The Trump administration's proposed or final rules are harmful and unlawful and represent some of the most extreme policy changes proposed to Title X since the program was established in 1970. Most significantly, the regulations would deny patients quality care that they rely on this program. And we cannot allow the Trump-Pence administration to create a two-tiered health system that dictates different lower standards of care for low-income and uninsured patients. We thank Senator Leyva for her leadership in introducing this resolution in support of the Title X program and calling on HHS to rescind the regulations. This resolution would be a strong commitment to the Trump administration of California's values and commitment to ensuring access to quality reproductive and health care for Californians. I respectfully ask for your aye vote.
Thank you. Are there others in support?
Mr. Chair and members, Josephine Figueroa on behalf of Insurance Commissioner Ricardo Lara in support.
Thank you.
Vanessa Hina on behalf of California Latinas for Reproductive Justice here in support.
Thank you.
Linda Tenarowitz with the California Pan-Ethnic Health Network in support.
Thank you.
Shannon Hovis, NARAL Pro-Choice California in support.
Thank you very much.
Move the resolution.
Second.
Is there anyone in opposition? Seeing none, we'll bring it back to the committee for questions or comments. Questions or comments from the committee? Seeing none, would you like to close, Senator?
Respectfully ask for an aye vote.
Thank you, Senator. We have a motion by Ms. Aguiar-Curry, a second by Mr. Rodriguez. The motion is that the resolution be adopted. Madam Secretary, please call the roll.
Wood?
Aye.
Wood, aye. Mays? Aguiar-Curry? Aguiar-Curry, aye. Bigelow? Bigelow, aye. Bonta? Burke? Carrillo? Flora? Flora, no. Limon? Limon, aye. McCarty? Nazarian? Ramos? Aye. Ramos, aye. Rodriguez? Aye. Rodriguez, aye. Santiago? Waldron? 6 needs to.
I messed up. I was a no.
We have a change of vote by Mr. Bigelow from aye to no.
Bigelow, aye to no. That's 5. Mays not voting.
You have five to 2. We'll leave the bill on call. Thank you very much, Senator.
Thank you, Mr. Chair. Thank you, members.
Item number, we'll go back in file order to item number 1. We will lift the call and call the absent members. Madam Secretary?
Bonta? Aye. Bonta, aye. Burke? Aye. Burke, aye. McCarty? Aye. McCarty, aye. Santiago? Aye. Santiago, aye. 10 to 4.
That bill has 10 votes. It's out of committee. 10 to 4 is the vote on that. Item number 3, SB 301. Ms. Leyva, please open the roll and call the absent members. Excuse me.
Bonta? Aye. Bonta, aye. Burke? Aye. Burke, aye. McCarty? Aye. McCarty, aye. Santiago? Aye. Santiago, aye. Waldron? 14.
That's 14-0. Item number 4, SB 322. We'll open the roll and call the absent members.
Bonta? Aye. Bonta, aye. Burke? Aye. Burke, aye. Carrillo? Aye. Carrillo, aye. McCarty? Aye. McCarty, aye. Santiago? Aye. Santiago, aye. Waldron?
14-0. And then we just did, actually, we'll open the roll, call the absent members on item 5, SB 746.
Mays? Santiago? Aye. Santiago, aye. Waldron? 12-0.
That's 12-0. And then finally, we'll lift the call the absent members. Item number 7, SJR 4 by Senator Leyva.
Bonta? Aye. Bonta, aye. Burke? Aye. Burke, aye. McCarty? Aye. McCarty, aye. Santiago? Aye. Santiago, aye. Waldron? 11 to 2.
That is 11 to 2.
Yeah.
Okay. I think with that, we will go ahead and close this hearing of the Assembly Health Committee. Thank you very much.